Healthcare in the United States is undergoing one of the most significant transformations in history, and at the heart of this change is the expansion of virtual healthcare and remote diagnostics. What began as an emergency response during the COVID-19 pandemic has now evolved into a mainstream approach to medicine in 2025. People no longer need to spend hours waiting in clinics or traveling long distances to access specialists. Instead, healthcare is coming directly to them through their laptops, smartphones, and even wearable devices. This shift is about more than just convenience. It is about building a healthcare system that is more proactive, accessible, and responsive to patient needs. Virtual healthcare integrates video consultations, remote patient monitoring, and digital communication platforms, allowing doctors to care for patients beyond the traditional clinic setting. Meanwhile, remote diagnostics and AI-powered devices are empowering patients with tools to track their own health in real time. This means that many conditions can be detected and treated earlier, long before they become serious. Whether it is managing chronic illnesses like diabetes or providing mental health therapy at home, virtual healthcare is bridging the gap between patients and providers like never before. In this video, we will dive deeper into three major components of this revolution. Hybrid care models that seamlessly combine online and offline healthcare, at-home diagnostic tools that put testing power directly into patients' hands, and AI-driven smart devices that analyze health data in real time. Together, these innovations are shaping the future of medicine in America. By the end of this discussion, you will understand not only how these technologies work but also how they are transforming outcomes, lowering costs, and empowering patients to take control of their health in ways that were unimaginable just a decade ago. 1. Hybrid care models. Hybrid care models represent one of the most powerful evolutions of telemedicine in the United States. In the early days of virtual healthcare, many people assumed online consultations would be temporary, something used in emergencies or when physical visits were impossible. But today, hybrid models are becoming the gold standard, blending the strengths of both in-person and virtual care to create a more flexible, patient-friendly healthcare experience. For routine consultations, minor illnesses, medication adjustments, or mental health therapy, patients can schedule a quick video call with their doctor from home. This reduces the need for unnecessary in-person visits, saving time, travel costs, and stress. At the same time, when physical examinations, imaging, or procedures are required, patients can easily transition to an in-person appointment. The integration between virtual and physical care ensures that nothing is lost in the process. Electronic health records, prescriptions, lab results, and doctor's notes are instantly accessible across both settings, creating a seamless flow of information. One of the biggest benefits of hybrid care models is accessibility. Rural areas in the U.S. often struggle with limited healthcare infrastructure, and patients may have to travel hours to see a doctor. Hybrid models eliminate this barrier by allowing remote consultations and follow-ups without the need for long trips. This is especially important for elderly patients or those with mobility issues who find traveling challenging. Another significant advantage is efficiency. Doctors can manage their time better, fitting in more patients through quick virtual visits, while reserving in-person slots for cases that truly require them. Hospitals and clinics benefit from reduced crowding and shorter wait times. Patients appreciate the convenience of choosing the type of care that suits their schedule and health needs. Hybrid care models are also improving continuity of care. A patient with a chronic illness like diabetes might meet virtually with their doctor for regular monitoring, upload glucose readings from home, and only visit physically when complications arise. This ongoing connection reduces the risk of health crises, as doctors can intervene earlier. Mental health is another area where hybrid care shines, with virtual therapy sessions making professional help more accessible, discreet, and consistent. In 2025, many healthcare systems are investing heavily in platforms that unify these hybrid approaches. Insurance providers are also increasingly covering virtual visits, making them financially viable for patients. Hybrid care is not just a temporary adjustment, it is becoming the foundation of modern healthcare, where flexibility, efficiency, and accessibility work hand in hand to deliver better outcomes for patients across the country. 2. At-home diagnostics. At-home diagnostics are another game changer in the transformation of healthcare. Traditionally, patients would visit a clinic or hospital for tests, wait days for results, and then schedule another appointment for follow-up. This cycle was time-consuming, costly, and often delayed critical interventions. In 2025, that model is rapidly being replaced by at-home diagnostic tools powered by artificial intelligence and advanced medical technology. Today, patients can monitor their own health with portable kits and smart devices that deliver immediate results. Blood pressure monitors, glucose meters, cholesterol testing kits, and even advanced DNA testing kits can now be used in the comfort of one's home. Results are uploaded directly to a secure online platform, where doctors can review them instantly. This creates a continuous stream of data rather than occasional snapshots, giving healthcare providers a much more complete picture of a patient's health over time. The real strength of at-home diagnostics lies in early detection. A patient might use a wearable device that tracks heart rhythms, alerting them and their doctor to irregular patterns that could signal atrial fibrillation. By catching the problem early, treatment can begin before a stroke or heart failure occurs. Similarly, continuous glucose monitoring allows for more precise diabetes management, preventing dangerous spikes or drops in blood sugar. These tools are also empowering patients to take a more active role in their own health. Instead of being passive recipients of medical advice, patients can monitor trends, adjust their lifestyles, and engage in meaningful discussions with their healthcare providers based on real data. This shared responsibility fosters better outcomes and stronger patient-doctor relationships. Insurance companies in the U.S. are starting to recognize the value of at-home diagnostics as well. Covering these tools reduces expensive emergency visits and hospitalizations, which ultimately lowers healthcare costs overall. For example, remote pregnancy monitoring kits help expectant mothers track blood pressure and fetal heart rates, reducing the risk of complications. Elderly patients benefit from at-home fall detection systems and remote monitoring, which alert caregivers or doctors in case of emergencies. The convenience of at-home diagnostics also cannot be overstated. Patients no longer need to schedule lab visits, take time off work, or sit in waiting rooms. Instead, they gain control over when and how they monitor their health. Combined with AI, these tools do more than just measure numbers. They interpret patterns and predict risks, providing actionable insights rather than raw data. At-home diagnostics are transforming healthcare from reactive to proactive, ensuring that diseases are caught earlier, treatments are more effective, and patients feel empowered in their healthcare journey. By 2025, this trend is no longer experimental. It is a critical part of how healthcare is delivered in the United States. 3. Smarter devices with AI. Perhaps the most exciting element of remote healthcare is the rise of smarter devices powered by artificial intelligence. While wearable devices have been around for years, their capabilities in 2025 go far beyond counting steps or monitoring heart rates. Today, they analyze data in real time, generate insights, and send alerts that can save lives. For example, continuous glucose monitors are equipped with AI algorithms that not only track blood sugar levels but also predict dangerous fluctuations before they occur. Patients receive alerts that allow them to take preventive action, while doctors can review detailed data trends during consultations. Similarly, implantable cardiac monitors can detect arrhythmias and immediately notify cardiologists, allowing for early interventions that prevent heart attacks or strokes. Sleep monitors, respiratory devices, and smart inhalers are also revolutionizing chronic disease management. A smart inhaler can track how often a patient uses their medication, identify patterns that suggest worsening asthma, and notify the patient or doctor before a serious attack occurs. These devices transform healthcare from reactive treatment into proactive prevention. The power of AI lies in its ability to process massive amounts of health data in real time. Instead of a doctor relying on occasional checkups, they can access continuous streams of information from their patients. AI systems analyze this data for anomalies, trends, and risk factors, providing doctors with actionable insights. For patients, this means a safety net that is always active, watching over their health every hour of every day. Smarter devices also improve communication between patients and doctors. Instead of waiting for symptoms to worsen, doctors receive alerts and can reach out with recommendations, medication adjustments, or urgent advice. Patients no longer feel like they are on their own between visits. They are supported by an intelligent system that bridges the gap. These innovations also bring healthcare closer to the home. Elderly patients, for example, can wear fall detection devices that immediately alert caregivers or emergency services in case of an accident. People with sleep apnea can use eye-enabled monitors that adjust treatment automatically through CPAP machines, improving quality of life and reducing complications. Insurance providers and healthcare systems are also embracing these devices, as they lower long-term costs by reducing hospitalizations and emergency visits. For society as a whole, smarter devices mean healthier populations, more efficient healthcare, and better outcomes across the board. In 2025, the boundary between personal technology and medical care is blurring. Phones, watches, and even household devices are doubling as healthcare tools. With AI as the driving force, smarter devices are not only monitoring health but actively improving it, ensuring that patients stay safer, healthier, and more connected than ever before. The expansion of virtual healthcare and remote diagnostics in 2025 marks a new era of medicine, one that prioritizes accessibility, convenience, and prevention. With hybrid care models, patients no longer have to choose between online and in-person visits. They can have the best of both worlds. With at-home diagnostic tools, people are empowered to track their health continuously, catching problems early and avoiding costly emergencies. With smarter AI-driven devices, healthcare becomes proactive, personalized, and responsive in real time. This transformation is not just about technology, it is about shifting the entire philosophy of healthcare. Instead of waiting for illness to strike, patients and providers now work together to predict, prevent, and manage health challenges before they escalate. The result is better outcomes, improved quality of life, and lower costs for individuals and the healthcare system alike. Of course, challenges remain. Ensuring that virtual care is accessible to everyone, regardless of income or location, is vital. Protecting patient data and maintaining ethical standards in AI-driven systems are equally important. But the progress made so far is undeniable. What once felt futuristic is now becoming routine, and patients across the U.S. are already experiencing the benefits. The future of healthcare is here, and it is virtual, intelligent, and patient-centered. As technology continues to evolve, the line between hospital and home will blur even further, giving individuals more control than ever before. The expansion of virtual healthcare and remote diagnostics is not just a trend, it is the foundation of a healthier, smarter, and more connected future for all.